I wanted to take a vacation as a result of the fact that, it's Thanksgiving holiday. However, this article on Kaiser Health News, published yesterday, is going to be pulled. This article by Kaiser is going to be pulled, used, manipulated every way to change the landscape of the conversation around Medicare Advantage, which was controversial already. My name's J.O. I'm the author of Maximize Your Medicare. You can just type in my name and Medicare on Google, hit return. You'll see about, 300 quotes, etc. in the national media about the topic. Now, the fact of the matter is that I'm going to try to go quickly here today because, candidly, I have other things to do and I'm exhausted. But the fact of the matter, I'm going to try to go quickly today and no script as always. Trying to go very, very quickly because of the fact that I have other work to do and Thanksgiving isn't just a couple of days. Anyway, let's just get started. So this article reports that Kaiser has actually filed a FOIA, which is Freedom of Information Act audit for the data that exists at the CMS, which is the Center for Medicare and Medicaid Services. I've got to tread very, very carefully here because of the fact that I'm a licensed person. There are all sorts of regulations regarding what I can and cannot say about carriers and plans, this, that, and the other. You don't want to be me because there are new regulations all the time. Now, the reality, the candid commercial reality is the following, is part of the reason for the massive overkill by me privately is because of the fact that a single extra person isn't worth the risk of wrongdoing to my professional practice, right? The lights will get turned off, right? If I'm intentionally misinforming, misrepresenting, the downside risk to me is so high that, the reality is I should be receiving counsel from friends who have stayed silent, who should all be saying, Jay, you should stop posting entirely. Meaning that my return from the newsletter and YouTube channel and the other information that I provide for free isn't worth the risk. That actually wakes me up at night. Some days I think, I should stop posting and just go 0 dark 30 quiet. However, the fact is that the misunderstanding is so awful on this topic, on financial topics, that if I let it keep going and running, you basically have the other thing, you have Harvey Weinstein and where silence just keeps running amok. And then you have a disaster, an absolute unmitigated disaster. And this has happened. I'm very sure of it. I've seen it. It will continue. To the degree that a single person can get the record straight, get their mind straight, use your common sense, I probably have done my job. All right. So this article says that newly released federal audits reveal widespread overcharges and other errors in payments to Medicare Advantage health plans for seniors, with some plans overbilling the government more than $1,000 per patient a year on average. Now, I am, as many people would see on this channel, avenues, whatever you want to call it, I am not a criticizer of this particular organization. It is the high end. It is the deep end of the pool. I'm not disputing a single fact that it will state. I am going to, however, dispute its presentation. That is different. And it's important, and the reason that I swerve here right away doesn't even take the first sentence. I can't even complete the first sentence before saying, yeah, but. Okay. No one said that this was intentional errors, right? There's a big difference between human error, variance, which is on one end, and on the other end, intentional error. Okay? By not distinguishing, they are allowing the narrative to run amok. You can see how terrible this is for us as a whole, who wants to take whatever they read and see and hear what they want, and they then take this little thread and pull it to the fullest degree possible. The reality is we have hypocrisy. You can call me a hypocrite if you'd like. I'm going to disagree with you, but sure. Okay. But you can see it here, which is that right away they don't separate what is intentional and what is unintentional. And the reason is because it's that difficult. And the variance, meaning that, I thought I was perfectly healthy. I woke up, couldn't get out of bed, had to call the ambulance. They found a DNA problem. And all of a sudden I realized I had pre-existing disease which had stayed latent. You have people walking in the park past instantaneously getting a heart attack with some undiscovered cardiac arrest, undiscovered cardiac problem leading to basically instant death. And this happens, right? In fact, I can tell you that a very close family friend suffered from this exact situation. So when you have error, right, the question is what's the source of error? Is it intentional? Is it unintentional? And for any party to say, okay, for sure it is intentional, I don't know. It'll be real tough to prove. Let's leave it there. Let's continue. Summaries from the 90 audits, billings from 2000 through 2013. So that's over 3 years. Okay, so this is important. We're going to get to math shortly. Okay, and said that 12 million in net overpayments for 18,090 patients. So I open this other tab, and what do I get? I did the math here for you, right? In other words, the $12 million divided by the 18,090 persons. And then what I did is I scaled it up for the Medicare Advantage population. And the estimate population, let's just call it 30 million people on Medicare Advantage. Okay? In which case, if you multiply this up, this is then $19.9 billion. Yeah. But then you have to divide it by 3, right? Because what we care about is the annual amount that it's costing the federal government. So now we get what? We get $6 billion. Now, this is not a trivial amount. I'm not disputing that. It also needs to be divided by some massively unknown number, which is GDP times our health care cost expenditure for that set of people. In other words, $6 billion is a lot of money when it comes to a particular singular household, not to Jeff Bezos, right? But $6.6 billion, candidly speaking, is what? 3 10-year note auctions in a year, of which we have 12? You see what I'm saying? In other words, the numbers are eye-popping, I get it. But then the fact is, we still don't have a handle on the denominator. Now you understand why I always call people who are flat earthers Numeratorville. You don't have a proper or any scaling correctly to percentages, which is what matters. Let's continue before I get off the rails. You could say I'm already off the rails. All right. Officials say they intend to extrapolate payment error rates and recoup $650 million as a result. Okay. So that basically, if we use our scaling and they're getting to recoup $650 million out of $6.6 billion, that's 10%. Really? Okay, let's continue. On extrapolation, Ted Doolittle, former deputy of CMS, says that I think CMS fell down on the job on this. Now healthcare for the state of Connecticut. Seems that CMS appears to be carrying water for the insurance industry, which is making money hand over fist off Medicare Advantage. All right, back to percentages. If you call up a Medicare Advantage carrier, they're going to tell you that when they're estimating after P&L, after their costs, low single digits of profits from the Medicare Advantage system. Now, I have to take this with a grain of salt, right? Because whether or not there's been padding of, SG&A, which is, administrative cost, etc., misrepresentation of that, okay, I wouldn't be surprised. I also would ask you rhetorically, name one business where this does not occur, right? Name me any business that is holier than thou on anything. We're going to get to me throwing real rocks at individuals and their manipulation of this fact and your misunderstanding of financial topics. Let's continue. 90 audits were the only ones completed over the past decades. That I'm not disputing is true. I've already scaled it for you here, right? I've already scaled it to today for you. This is a good working number under the presumption that the rate of errors is constant. Under the presumption that the rate of error is constant. If, however, Medicare Advantage carriers are intentionally increasing the upcoding, then the numbers are going to be off. Okay. Uncovered overpayments. Okay, so now here we go. 71 of the 90 audits uncovered net overpayments. So, importantly, it's net, meaning that it has topped at 1,000 per on average in 23 audits, right? And then also glossed over, I promise you, on Twitter, at the bar, fancy cocktail party talk, is the fact that CMS paid the remaining too little on average for the remainder. Okay, in other words, remember when I started this whole conversation about the source of error? Errors are two ways, right? No one said it's error only in one direction. And here, KHN admits it. Let's continue. Flag overpayments when a patient's record failed to document that the person had a medical condition they're going to treat. Happen on average for over 20% of medical conditions over the 3-year period. Okay. So now we get into the fact that this article is going to be used as ammunition of stuff. In fact, it didn't take even until midnight. I went on Twitter. Terrible idea by me. Such a bad idea, it's killing me. Here is... Let's just take a couple of examples. So this person on Twitter, Adam Gaffney, I don't know who it is. Medicare Advantage business model revolves around 3 strategies. Upcoding, avoid sicker patients. Wrong. So this is all sorts of A, wrong, and then B, hypocritical. Upcoding to make patients look sicker, increasing payments from CMS. Is this possible? It is possible. It is possible. Does it happen? I'm pretty sure it does. Why? Because we have actual settlements from carriers settling with the CMS at certain points in time. Certain carriers have closed as a result of it. Avoiding sicker patients, reducing costs. Patently wrong. It doesn't matter. You could have stage 4 prostate cancer. You could have stage 4 pancreatic cancer. If you switch to a Medicare Advantage plan, they've got to accept you, period. So there's no avoiding a sicker patient. No such thing. Third, deterring use of care and retaining the savings as overhead profit. So this part ignores the Medicare loss ratio rule, MLR, right? Carrier has to spend 80% of the monies it receives towards claims. It pulls out of context then, this person pulls out of context the very article that I'm reviewing with you now. And you can see it here in this middle section. And now you can understand that, my stomach is starting to churn. Because this is what I'm saying, is that people are using social media, and let's just say social media, not really because of social media's existence. It just is, characteristic of similar conversations you're going to have at, like I said, that you've had at the bar or you've listened to at coffee hour, etc., whatever gathering or motivation or, location. My problem on this, and as the punchline to this, is this. This person is a pulmonary and ICU doctor. Followers of this channel understand this. And now you can understand why I had to hit record. Being medical doctor doesn't qualify you for analysis of financial contracts. Period. That doesn't make this person dumb. That doesn't make this person not able to learn financial analysis. No, clearly not. This person went to college. This person went to medical school. This person went to postdoc where he had to get a specialty. All granted, 100% granted. Those are different specialties from what I'm talking about on this channel, right? You're not going to ask me to read your x-ray, right? I wouldn't try it. I would tell you, I'm not a medical doctor. Go to your x-ray technician, go to your radiologist. They're trained in that specialty. Somehow, this is why I have my little shorts, right, that say, I'm not talking about, underneath my pants. I'm talking about the fact that healthcare is not the same as health insurance, and we are so far off base in the conversation about what is wrong, that what we have done is this person feels like he is qualified to be a person to opine about the structure of financial contracts. How we got this far off track, I don't know, right? I don't know. Well, actually, I have some guesses, right? Because but my point is, people are so confused right from the beginning and at a loss for how to understand when they could have understood right from the beginning. But if the earth is flat, you're going to have the wrong estimate on the distance between two locations. That's it. Dr. Gaffney, you are not a financial expert. Your statements here are not correct. This one, number 2, is particularly a particular illustration of how far off base You are. Let's continue. This person, this just goes on and on, by the way. These are just ones that I chose to show you. Right. Dr. Fleming. I'm calling today a major success because my relative with a history of sarcoma got off Medicare Advantage and onto traditional Medicare with gap coverage. His previous restrictive plan wouldn't let him see any doctors outside of his local network. Could this have happened? Yes. Whose fault is this? This is your fault, Dr. Fleming, or your relative. It's not the Medicare Advantage carrier's fault that you didn't know what you were buying. You didn't know what you were applying for. This isn't caveat emptor that somebody's doing something like, intentionally wrongfully. It's a contract. It's a financial contract written by lawyers. The partner of that lawyer, of that law firm, I promise you, bills out at probably something like $10,000 an hour. An hour. The idea that they wrote a vague financial contract is zero. Almost no chance. The idea that the writer, the Medicare Advantage carrier, intentionally violates nevertheless didn't stop this doctor from calling something a major success. He's miscalled what is a major success as pure luck. His relative was lucky because why? That despite the misunderstanding that there were consumer rights that allowed them to revert back to original Medicare. Yet we've qualified and anointed because of MD as if this person is an expert and someone you should listen to here when it comes to Medicare Advantage. By the way, do we see any doctors bragging about the fact that they took a big bonus as a result of the fact that they hit a cost-cutting target, of which his or her practice, hospital system, got extra bonus payments as a result of hitting these cost-cutting measures? Or the fact that that hospital system is owned by insurance carrier? Or that doctor received a bonus for hitting enrollment target numbers? Funny that doctors aren't highlighting that here on Twitter, isn't it? And this is why I'm this fired up. Because you can see from what I've just said over the last 30 seconds, the hypocrisy involved. I don't have a problem. You want to state a particular scientific fact, you're a medical doctor, right? You needed to have personal and determination or to pass and to pass the MedCat to a level to get into medical school and get your MD degree. That is undisputed. That is completely undisputed. The idea that qualifies you to make statements about financial contracts? No. Why am I doing this? I frequently ask myself. It's because this is very systematic of the type of misinformation, misdirection, hypocrisy that you see. And the problem here is that you, the listener, the audience, the buyer, the Medicare Advantage member, gets led by the wrong unqualified party, which could have been avoided. Before I continue on. I've got work to do. I've got a real life, or kind of. Anyway, be sure to leave your comments, questions, like, subscribe to the channel. Hopefully you're getting stuff from my insight. The Substack there, the URL beneath my picture and image there. Subscribe to it. There's a paid version. This video only going to the paid version. So I guess I shouldn't have even said that. I guess I need to make a preview video, don't I? All right. Thanks very much, everybody. Have a great day. Happy Thanksgiving. I'm not sure if you feel like, I don't know. I don't have much of an appetite after all of this stuff. I should go back to the article, actually, right? And let's just continue just for 1 second here. Okay. Billing showdown. None of this is news, right? I've discussed this in other locations. I'm going to tell you how to fix it. So this is why this sits behind the paywall. All we need to do are two things. Number one, we need to eliminate the idea, the principle of coding. Mr. X, Miss Perfect, Mr. Sick-a-Lot, right? They both sign up to Jay's Insurance Company Medicare Advantage Plan 1. My company should only receive a flat amount irrespective of whether or not that's Miss Sick-a-Lot or Mr. Perfect. That would eliminate the variability here. If I've miscalculated, right? If I don't accept that number, right? I shouldn't be in business for there in Medicare Advantage. If, in other words, the reason you have this proliferation of plans and this fierce fighting, and maybe you can work backwards and say that's evidence that there's too much variability here, is simply eliminate it. The second one has to do with these persons here. The way to eliminate the hypocrisy here is simply ban all payments to healthcare providers, period, for any other reason than compensation for direct service. The doctors are motivated, candidly, are profit motivated, and you've seen what I've said about the New York Times article. I'll leave a link below the video. The doctors are motivated due to the bonus payments. Why do they exist? For what? I know what they are. I can tell you what I think they are in a different video, sure. But my point is the incentive scheme exists to have the increased number of plan members. The plan then gets extra bonus payments for hitting cost-cutting measures from the CMS. That exists today. The way to stop this is simply prevent Dr. Gaffney, and not saying that this particular doctor, I don't know Dr. Gaffney, I don't know how he's compensated. I do know that medical doctors are compensated in that way, is to simply eliminate it entirely. That if they can't make the numbers work, they need to think about the way that they are employed. None of those are going to be very popular statements. I get it. Part of the reason for behind the paywall. All right, now I'm going to stop. Thanks very much, everybody. Have a good Thanksgiving.